Okay, so now moving into some specific techniques. So we are going to be covering the external ionizing radiation in this video. And so if you recall from our previous discussion, ionizing radiation is radiation that is very high in terms of their energy, very short wavelength, and can be quite dangerous to the body when taken in large dosages or even smaller doses repeatedly over time. So one of your major concerns when you're dealing with ionizing radiation is minimizing its use, which can be problematic for research methods. Where we tend to see external ionizing radiation used the most is in hospital settings, medical situations, and many of you guys are probably familiar with the core ionizing radiation technique, which is X-rays, which uses the high energy of the X-ray that is fired at the body, right? And then the body will absorb those X-rays, and there's film. So you are between the film and the X-ray source. Right? And as the X-rays travel through the body, they strike the film, but certain parts of your body, like the bone, will absorb more X-rays. This means that the bones appear white the thicker they are. Thinner areas are going to appear more gray. Tissues, for example, are going to appear quite gray. Any breaks in the bone that allow air through are going to appear as black, which means that the X-ray is most commonly used to detect broken bones. But there are many other uses for X-rays. But the idea is that it takes an external source of radiation, fires it through the body, and then some film detect the presence of the X-rays, and we create an image based on how the different parts of your body are absorbing the X-rays. You can do certain things that change the opacity or the absorption of X-rays. There are certain dyes you can put in that will actually make X-rays more or less likely to be absorbed. You can see this most commonly in the angiogram or arteriogram, which attempts to look at blood flow in the brain. Right? And this lets you see the flow of blood through the body by injecting a dye into the veins, which changes the opacity of the blood to X-rays, allowing us to image clots or bleeds or any other issues. For our purposes, though, for neuroimaging, the most common technique that can actually be applied to take pictures of the brain is what we call the CT scan, or the computed tomography scan. The CT scan is basically an X-ray machine, but instead of a single X-ray, a large number of X-rays are taken in a circle. So your head is placed in the center of the circle, and it's going to be rotated around the head, or it can be any part of the body, but we're doing neuroimaging. So it rotates around the head, taking hundreds of X-rays from every conceivable angle, and then a computer takes all of those different angles and is able to detect slight changes in the opacity of the skull and can recreate the tissue image of what's actually appearing inside the brain, inside the skull. So that's the brain, obviously. Right? So the idea is it just circles around the part of the body that it wants to take a picture of, and then uses a computer to reconstruct the imaging. And as you can see here, we have a brain. It's actually fairly weak in terms of its resolution, and it comes at the expense of lots of X-rays, which is always a concern. We want to try to minimize the number of X-rays that we're going to apply, and this machine does a lot of X-rays. So again, for research purposes, it's not great. It doesn't offer a whole lot of pros other than it is widely available. Pretty much every hospital in this country is going to have a CT scan. It's incredibly cheap compared to the other techniques that we're going to talk about. And in fact, the CT scans have gotten to the point where they're now beginning to equip small, inexpensive units in ambulances and emergency vehicles to be able to do scans right away. One of the reasons why you might want to do that is the effect of stroke. CT scans are actually invaluable in trying to come up with treatments for strokes. Strokes is when the brain is not receiving oxygen because something is blocking the blood flow. The vast majority of strokes are what we call ischemic. About 80% of them are going to be ischemic, and this is when a clot is blocking blood from entering the brain. We have clot busters like TPA that can dissolve the clot, allowing blood to be restored, dramatically reducing the fatality, damage, and dramatically increasing the recovery of the patient. But about 20% of strokes are not actually caused by a clot, but rather hemorrhagic, where the blood is actually escaping into the brain and blocking the flow of oxygen because there's pooling of blood. If you give TPA to a hemorrhagic patient, they're likely to die. So we have to make these decisions of who do you give TPA to, who do you not. If you give it to everybody, 20% of your patients are going to die when they don't need to. But if you wait too long to deliver it, the benefits of TPA dramatically drop off the longer it takes to give it. This is where the CT scan becomes invaluable, and why having CT scans available even in emergency vehicles becomes important, because you can easily differentiate ischemic versus hemorrhagic strokes in a matter of minutes by looking at them in the CT scan. In the CT scan, the ischemic strokes are going to appear as darkened regions of the brain, whereas the hemorrhagic strokes are going to show the blood as a bright white spot. Do these scans in the emergency vehicle, and you can have information available to the doctor as soon as you pull up to the hospital, and treatment can begin right away in the appropriate manner. So that's why you see CT scans. One of the reasons why you see CT scans so widely available, because they're inexpensive, the technology is well known, and they have some useful medical applications. They do provide imaging of the brain, but the resolution is relatively poor. And the con of the large amount of external ionizing radiation makes it difficult to find research applications. We will actually begin talking about what techniques are used more often in research starting in the next video.